thinking of launching, most important thing to consider would be is test everything that you're planning to launch. If you have templates, if you have forms, if you have, you know, any kind of survey tools, please make sure that you run it internally in your team. And let me put it like this: if a spoke come back and give you a feedback, you know what? I think there is a requirement of one more question. Or the questions are too many in this form. Can we cut it down because there is repetition happening? We should always actively listen to our spokes as well. And that's why we call it's continuous improvement, not at the end of the program, but throughout the course of the program, right? You can also see adjustments in device, make it easily available everywhere. Always remember, you might think, Anmol, why have you added templates and forms? They are data collecting tools for us. Let's say a learning community member is presenting a case on a template, and you have 20 odd cases presented, and 5 cases were presented orally. You will never get track of what happened in the oral cases. But you can always track down presentable cases in future as well. So let's say hypothetically a learner presented a case on day one on a case presentation template. And by the end of the program, you want to review that case. You can easily do it when they are presented on a template. But if somebody has presented orally, you would never be able to track it down. So make sure templates are standardized and used by everyone in your learning community. Now the next thing would be is, as you are running your echo sessions, why not involve one of your team members to just observe your echo session? Of course, Echo India would be doing it, but learning it from your own team is the best learning. So let's say hypothetically, Parash is going to run an echo program. Why not you call somebody from your team who is attending the session and filling the checklist for you? And these checklists are easily available on Project Echo Resource Library. If you don't have that, Echo India will be happy to support you and give you the same checklist. The idea is just to take feedback from each other. In this checklist, there are different components: facilitator, presentation, case presentation, so on and so forth. The idea is to find hiccups and course correct immediately, right? Let's not wait for the program to get over. Now, the last thing which comes out to be is monitoring and quality improvement, right? All the data that you've collected over a period of time, all the routine assessment you have done, you keep on improvising yourself with it, right? Maintaining data at one place. It's one of the key criteria in the monitoring and QI phase as well. It would be my humble request to all of you, let's not add data into different places. Let's make sure all the data is covered in one place only. If you're using Spark, the data should be available in Spark only. If you're using iEcho in the future, all the data should be in iEcho, right? Have review meetings. Now, in one of situations, you'll get to know Echo India team wants to have a feedback call with you. Or that call would be a review meeting to discuss what went wrong, what went good, and how can we improvise, right? And the last thing I would request all of you to do is analyze and interpret as an ongoing thing. Analyze your programmatic activity of each program. Let's not wait for multiple programs to get over, because if you analyze one program, at the end of it you draw analysis, you can compare it with your new program also, or you can compare it with the series of programs, right? And it is important for this information to be disseminated over a period of time, be it funders, be it government, or be it your leadership. Then only the movement of Echo will expand when we share information at the right time. Now that's briefly our phases, what you have to do. How do you plan, implement, and monitor continuously. Now, when you talk about monitoring, one of the key areas that I would request to all the hub leads here would be is make sure that you continuously take feedback from your learning community. Feedbacks are very important for Echo to know how the learners are feeling. Their satisfaction can only be, their reaction towards Echo program can only be attained through feedback surveys, right? And feedback surveys are to be done after every session. So as soon as you finish your Echo session, you do feedback session. Now that feedback form acts as an important tool for continuous quality improvement. Moreover, it identifies gaps and problems to help improve your training programs. Now, when you're designing your feedback form, make sure it's easily accessible. And when I talk about easily accessible, it should be on Spark, right? It should be session specific. When you're doing a feedback form for a session, it should be session specific or should be generic. It should not have topics or problems to be discussed in it. Now, one of the unique things that other hub teams and one of the Mrs. Rai's Echo also follows is reflection forms. Sometimes people are not proactively filling feedback form or they are not able to give their feedback about the echo session. In that scenario, the education team also uses the reflection form. Now these are open-ended questions, as you can see in the right side of the screen. It talks about, the learner to identify what was the key learning of the session, right? The change in behavior, the challenges, and use that reflection form in the next session to course correct those areas, right? Or help them in understanding what they left in behind, right? So these are basic ideas to give to you. I mean, you might innovate, you might improve as you create your echoes, uh, but please follow a sequence of your measurement of your programs. Think of planning it well in advance. Now, when I talk about these, uh, give me a second. Okay. So you must be thinking, what are other echoes they're measuring right now, and what are the areas that they primarily worked on. I mean, I'm talking about so many measuring activities. Now, echo primarily, as it was on healthcare, we use Moose level primarily here. We talk about participation satisfaction, right, which is basically feedback forms to identify their engagement. Then we try to identify the what is their level of preparation, right? Is it declarative, is it procedural? Now this is focusing only on healthcare because Moore's level is mostly used on healthcare. But when I talk about education, I would suggest you to use Kirkpatrick's. Kirkpatrick model easily applies on echo programs which are running on education. In healthcare, patient outcomes, Moore's levels are used, right? There have been multiple studies over a period of time which shows how echo has been effective. And as I said, the first two steps are common in all echoes, participation and satisfaction. For you also, I would say aim towards participation and satisfaction levels, and then think of engaging your learners to find their overall learning competencies as well, right? So over a period of time, since last you know 2003 echo started, there have been more than maybe now 300 reviewed publications, and most of the publication you would notice here is are focusing on participation and satisfaction level. And I'm sure that these two indicators reflects how well your echo is doing. Okay. Now, areas to build upon, what things that you can think of when you are planning your echo programs. Think of available tools. Now there is Box. You can go to Box, you can find different kind of measurement tools that different echoes are using, right? There is a list of our publications. There might be some publications on education as well, right? So use those information to create your assessment criteria also, right? There are education specific collaboratives, which are echoes, hub teams connecting together, focusing on education only. So different hub teams from different geographies connect on one specific day to talk about their echo programs or initiatives they would like to start in the coming time. So it's basically learning from each other. There are existing tool in Box, to create the logic model, uh, and you can easily found it and download it. If you want to use it, I would say feel free and feel ready to use these information. If you think that you're not at the stage of creating a logic model, I would say leave that behind at the beginning. Think about doing it in the next program when you feel more confident of doing it, right? Now, overall lessons to learn in this whole discussion. I know it's extensive discussion today. Mostly I'm telling you what to do. But the key to success for any measurement activity would be is plan, plan, and plan. Set time frames. Set identifying time frames. When do you want to assess what? Be inclusive in developing plans. So involve stakeholders, content experts, evaluators who can tell you how to evaluate your echoes, right? Plan the outcome measurement and evaluation early, right? I'm talking about only planning. Conducting would be happening after a period of time, but planning needs to be well in advance because you'll be identifying the activities that you need to follow. As I said in the last slide, don't try to do everything. At initial programs, you might not be able to conduct a lot of measurement. Their echo will be there to support you, right? We have our own monitoring and QA team. There is evaluation team who will be helping you out in case if it's required. For me, I think reviewing literature, papers, and publications really help in creating programs as well. You know, I'm not saying what education is doing is going to be absolutely different from healthcare. So maybe try to know what different echoes in healthcare did, because capacity building is common in both of them, right? There is no difference. The next thing would be select the best survey tool, right? So collecting information through these tools are critical, and identifying the right questions to be asked in the tool becomes pertinent as well. And again, test the results before distribution. So why not just share the survey tool internally in your team and ask everyone to fill it? If they feel the tool is too extensive, they will give feedback to you. If they feel the tool is not self-explanatory, they will give feedback to you. And you improve upon it as you get feedback. Now that's not briefly, that's the comprehensive discussion on what outcome measurement and quality assessment is. Uh, if you have any questions, I'll be happy to take. Uh, Aditi, do we have a couple of minutes for questions?
I think there has been a great discussion in strategic planning, and all the participants are still letting it sink in. But nevertheless, we can still, have consider a few more questions if you have any. You would like to ask, please feel free to do so.
Okay. Sometimes fourth principle comes out to be too times-taking exercise, but again, my request to all of you would be, please pay an extra attention when you're designing your eco programs. Make sure that the fourth principle is inculcated in your program. These activities are part of your program from the start till the end. Uh, I'll be happy to take questions over the chat if any questions are there. But I would be meeting you guys again in future when you are starting your eco program. So we can address these questions at that point of time as well. Thank you again, everyone, for interacting and answering questions. Over to you, Aditi. I wish you all the best.
Thank you very much, Anmol, for sharing that very, very in-depth, discussion on quality and monitoring and the fourth principle of ECHO. We hope that we will be able to use the learnings in our ECHOs when we launch. And of course, we will get back to you with more questions, because as we get into the actual real implementation of ECHO, the questions arise more. So we will be in touch with you for getting these solutions and answers. For now, I think we're heading for a break, the lunch break that we have planned. We have a break for around 20 minutes. So, yeah, we will see you after the lunch break. Thank you.